National Gallery Singapore has been recognized for using the arts as a healthcare toolkit. It has been designated as a healing arts center of excellence. It is the first museum to receive this accreditation, joining cultural institutions such as Carnegie Hall in New York and the Scottish Ballet. National Gallery Singapore says it will champion the role of museums as partners in public health and well-being. Mohammed Bahajjaj with more.
It's about slowing down and improving mindfulness through art. This is one of the programs at National Gallery Singapore that made it a standout candidate as a Healing Arts Centre of Excellence. The designation was conferred by the Jameel Arts and Health Lab in collaboration with the World Health Organization. The lab is a global program that aims to integrate the arts into mainstream healthcare.
So we see the National Gallery of Singapore as providing both local and regional leadership. They can be like a beacon, inspiring other institutes, other cultural institutions to take on this arts and health program, not just in museums, but concert halls, galleries, performing arts centres.
The gallery was assessed through criteria like its dedicated team and sustained initiatives for the underserved communities. These include collections and tours for the blind or people with low vision, and programs for those with dementia and their caregivers. There is even a dedicated space for visitors to rest if they feel overwhelmed.
Over here in the calm room, while it is open to all people, it was designed with the neurodivergent community in mind. This comes with sensory-friendly features like this weighted blanket and lights that can be adjusted to more calming hues by the staff nearby. Now, all of this to make sure that the visitors have a space to regulate their emotions like stress while enhancing the museum experience.
The gallery is also looking into bringing museum programs into community care spaces.
We have done a pilot with All Saints Home from August to October this year, and we've seen really good and positive responses. So I think there is room for us to grow that further and see more social service partners actually come on board, right? To grow up with you not just as a museum program, but a program that really can serve the diverse community needs in spaces that they're very comfortable as well.
Other local organizations will work with the Jameel Arts and Health Lab to develop research in the field over the next few years. There will also be pilot programs aimed at being scaled up in the region.
And we take a quick look at the other healing arts centers of excellence in the world and how they've stood out in the arts and health global landscape while paying attention to underserved communities. First, Carnegie Hall in New York was the first to be designated in September last year. The 134-year-old concert venue is known for renowned acts like Tchaikovsky down to the Beatles. And for more than a decade, it facilitated programs and presented concerts in diverse settings, bringing the power of music to the widest possible audience. And in January this year, the Scottish Ballet was designated as one such centre. It has contributed to dance initiatives developed with health institutions, such as for those with Parkinson's, dementia, and multiple sclerosis. It has also initiated programs for health and social care professionals to combat physical and emotional stress. And for more, Dr. Nisha Sachinani, who is founding co-director of Jameel Arts and Health Lab, joins us for more. Nisha, welcome to the show. Now, we've seen earlier the examples overseas of both Carnegie Hall in New York and also the Scottish Ballet. But what do you think makes the National Gallery Singapore so unique as a healing arts centre?
Well, what really struck me was how seriously the gallery takes well-being as part of its mission. This isn't something that's happening off to the side, but rather really built into their programming, their partnerships, even their staff training. Their work with different communities is just incredibly thoughtful and culturally grounded. And importantly, they're really committed to evaluating what they do. So it's this combination of creativity and care and rigor that makes them such a strong leader in this region.
And what kind of global evidence do we have for the impact of arts and culture on clinical and also public health? Do you have some examples for us?
Well, over several decades, research has rapidly shown that the arts support our neurological, our physical, our mental, and our social health, from everyday well-being to clinical care across all ages. In 2019, just to give one example, the World Health Organization published a scoping review of more than 3,000 studies that found clear patterns. Regular engagement in receptive as well as active arts like music and reading, dance, theater, visual art, gardening, or crafting is linked with lower stress, stronger, healthier behaviors, stronger social connection, and reduced risks of anxiety and depression. And these benefits exist and extend into clinical care as well, where you see creative arts therapies like art, drama, or music therapy demonstrating measurable benefits and improvements in pain, in rehabilitation, in maternal well-being, and in quality of life for people with chronic conditions.
So there's clearly a lot of benefit there, but what role do you think that museums specifically play as partners when it comes to public health and well-being?
Well, museums, first of all, are designed intentionally to draw the eye, to call your attention, to convene people. So I think that it's just been overlooked in terms of its health and well-being potential architecturally, and then in terms of the content that it curates and how that can respond to the values, to the concerns, and to the interests of the communities that they serve. You know, we're used to thinking about educational institutions and hospitals and medical centers as anchor institutions in any city or any community, but cultural institutions like museums are also anchor institutions. They support the health and well-being of the neighborhoods in which they are and beyond.
Like, for example, the calm rooms in National Gallery that allow people to have more mindfulness in their daily lives as well. Now, how will local organizations then work with Jameel Arts and Health Lab to develop research in the field over the next few years?
Well, I would say that, you know, everything that we do at the core of our approach is partnership and collaboration. And everything that we've done thus far has been developed with local organizations such as the Gallery, the Center for Music and Health at Yonsei Tao Conservatory at NUS, the Nanyang Academy for Fine Arts at UAS. And their leadership and insight are ensuring that our work is meaningful and sustainable in the region. So first, we want to develop high quality research with Singaporean partners, research that can genuinely shape and influence policy and practice, build on the excellent research that's already here. Second, we're focusing on capacity building, on training, and supporting an ongoing community of practice in Singapore so that people across cultural and health sectors can continue to have a forum for exchange, the exchange of perspective, ideas and practices, just as we're seeing over the course of this Healing Arts Singapore Week. And third, we're co-designing pilot programs in hospitals, in community settings, and cultural institutions that hopefully can eventually be scaled.
Can you tell us more about these pilot programs then? How are you looking to scale them up in the region?
Again, I think we will look to our partners to look at when is it relevant, responsive, and meaningful to scale programs that have been developed in a Singaporean community center, cultural center, or healthcare institution, and where might it make sense to scale. Sometimes the best approach is taking something that's working in one integrated care center, for example, and bringing it to the rest of the integrated care centers to support quality of life for older adults, for example. And in other cases, it's about adapting programs to best suit the needs and interests of the local community. So I think that we will continue to walk together as we seek to answer that question.
Definitely look forward to that. Now, Nisha, thank you so much for sharing your views with us. I've been chatting with Dr. Nisha Sachnani from Jameel Arts and Health Lab.